Guys, welcome back to Medical Coding with Blue. Today's episode is all about what is it like to be a medical coder. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So if you are considering this field, or if you are in medical coding school right now and you want to know, like, what am I up against when I get out in the real world? This is my point of view as a 17-year veteran. Now, keep in mind, a lot of the things that I do, there's a lot of coders that just do not do. Like, they're intimidated, they're scared, they don't want to, or they say, that's not what we do at our facility. So whatever the case may be, and whatever other people's experiences are, that's their experience. I enjoy this field very much. Are there things about being a medical coder that I don't like? Not a whole lot of things, but my things are more of like on the administrative side, like having a meeting that could have been an email. That's one of the things that I don't like. But that's any job, okay? That's just any job. But for the most part, as medical coders, we review documentation, and that's what I do all day. I work with the electronic health record. There's not a whole lot of places that still use paper. There are some places, but they're going to be very small places that use paper, because this is an agreement with the insurance and everything about, and some of these government programs about using the electronic health record. And this is what's going to make it more legible and easier to read. And anytime somebody does document on paper, that paper gets scanned into the electronic health record so that it becomes a part of the record. So it's either way, you're going to be working with computers. So that's what I do. I work with computers as far as like the electronic health record system. And every electronic health record system is different. There are some that are more efficient, that are designed better than others. The electronic health record, I've worked in 3 other than this current one that I'm in. And if you watch my channel for more than 5 minutes, I do not particularly enjoy the electronic health record that I'm in right now. And I will not name which one it is because it is just so poorly and terribly put together. It is not efficient. The system does not talk to each other, which is ridiculous, and it is very time consuming. So with that said, I'm going to leave that one there. But I do work with the electronic health record system. And yes, while there's other ones, there's big names out there. Not everybody works with those. I've never worked with Epic, and it's fine. I'm not like whatever, but that's one of the things that you do have to know when you're coming in, is that you will be working with the electronic health record. Now, you do get training on the electronic health record, so if you've never been in the medical field before, don't panic. I mean, when I very first started, my very first job was at the Cancer Therapy Research Center, and we used paper. So it was back then in 2008, so we were with paper at that time, and so that's what we were coding from. And that's what we did, But the thing about using the electronic health record is that using an encoder along with it helps to speed up the coding process. The encoder did not take the coder's place. There are things like computer-assisted coding, which is part of the electronic health record. When the provider is going in and documenting, the computer-assisted coding will start to pull diagnoses out and procedures out that it's seeing, right? That it's programmed to see. And so that's where, like, in order to close the encounter or to close out, their part of, documenting, the electronic health record computer assisted coding will start selecting those diagnosis codes so that way it can be closed out. It's on the coder to go back in and look and see, are those correct? Are they in the correct order? And a lot of times it's not. Those codes are not correct because they're unspecified. It's weird code selections that are made that are sometimes not even relevant to what is actually going on, but it depends on where the provider documented that information in the record. Sometimes I've seen in the past where a provider documented fall. And so the system is looking for an injury, but the doctor was referring to the season. This is why I don't worry about AI, because AI is dumb and it is only programmed based on a human who programmed it. And a human that is, again, not part of our industry. They're just a software developer. And so that's the thing, nobody can ever tell me about AI because we have critical thinking as human beings. And that's why it's so important for us to constantly stay up on our knowledge base, on our game, in order for us to stay ahead. And that's really what we do, as we stay ahead that way. They've been threatening us with AI since I started. And again, I started in 2008. And they've been threatening that ever since then. And I'm still here 17 years later. So with that said, I did a video last week about what reading medical documentation is like. And a viewer had commented on there and said, do you ever question like the provider's diagnosis or why they didn't run a particular test or anything like that? What about queries? So I never question a provider's diagnosis because that's not my job. I'm not a doctor and I didn't go to medical school. Although I always say at this point it would have been easier if I would have gone to medical school so I could really understand with the coding. But I didn't go to medical school, so it's not on me to question their diagnosis. What is on me is to make sure that their diagnosis documentation is clear and it's understandable, so that way I can pick up a correctly what's going on in this particular encounter. I had a provider who was taking care of a patient's metacarpal fracture. Okay, metacarpal. But in the cast portion of the note, the provider documented metatarsal. So I had to send a query. I said, I sent the form and everything, and basically, please clarify, is this a metacarpal or is this a metatarsal fracture? And then she responded back with, it's there, Blue, it's documented, it's a metacarpal fracture. And I responded back that, again, according to the documentation, the cast portion of the note indicates metatarsal fracture, and whereas the history and the physical exam and the assessment and plan, they're all indicating this is a metacarpal fracture. So please clarify which one is it in the cast documentation. So she was like, oh my goodness, so that's something that I would have to clarify, because again, we have conflicting documentation there. And that's a good example of, trying to query them, like, what's going on with this, please clarify. So those are things that I do as a coder, and not everything that I do, you're going to do. Okay. So again, if you're brand new, or if this is, a new field for you and you're still studying it, not everybody's going to educate providers, and some coders don't even query providers. They send the query to the nurse who fields those, and then sends it on to the provider if it's legitimate, which I don't think is right, because the nurse is not the coder. And nurses, even though they say, oh, this would be so easy for nurses to understand, nurses often do not understand the fundamentals of coding. They get a false sense of, oh, yes, I know how to code, because they have a super bill, and they're usually checking off diagnosis. These are the diagnosis codes that we normally use. It doesn't matter. Not everybody's going to fall into that same category. And there's rules about sequencing. There's rules about specificity, and there's rules about, okay, does this patient have this condition and this condition? Then we use a combination code. So there's lots of things that they don't know. And they're, again, under that false sense of, oh, yes, I know because I do the coding for my provider. No, you don't. You check off on a super bill that these are the diagnoses that we always select from. No, I don't think so. That's not coding. That's selecting from a super bill. Okay. So, like I said, some places are like that, where they send it to the nurse and the nurse handles it. And then, or then they send it on to the provider if it's necessary. And then there's other people that will have a physician educator, and it goes to that person, and that person goes and talks to the provider. So sometimes it's out of the coder's hands. Again, I don't think that that's right, but I would never work in a place like that, but that's just me. Okay. So the other thing about being a coder is sometimes you have to educate. And if you're educating other coders, when I first got here to my forever home, the lady that was in charge of the department was a former drill sergeant. So she knew a lot about managing personalities and managing people. And one of the things that she said from the get-go was, once a month, everybody in these different clinics, we're all going to take turns educating. Excuse me. we're all going to take turns educating, and you're going to have to, if you and your partner are working in a particular clinic, you have to educate, you have to come up with a whole PowerPoint presentation about things about your clinic so that you can teach all of us. And she did that because it's a way to get people more confident with public speaking, because a lot of people are not confident with that. It also helps to learn. When you're doing a teach back method, you have learned something, now you're going to teach it back. And that's what she was all about. She loved education too, and that's a great thing. It's good when, organizations and departments do that, because what we do is very important, and it is very easy to fall back into a very complacent, oh, we always do it this way and these are always the codes. That's why they always say that you have to have an outside agency come in and look at your coding just to verify that you're actually coding correctly, because again, it's real easy if you're not staying up on education and the new guidelines that are coming out and everything, in order to keep yourself and your facility compliant with the coding. So, but she would make everybody teach, and I thought that was like the best thing ever. I loved those because it gave the people a chance to explain and talk about their particular specialty, and then it gave everybody else the opportunity to learn something about that specialty as well. So that was a great thing to have back and forth. And then I started with provider education on my second job. I've had 4 jobs, but the first job that I had was at a cancer therapy research center where I was coding from paper. And then my second job, I was working at another hospital. And in this hospital, there was a lot of us that were new. And so one of the doctors came into the coding room that we were all in, and I happened to be there, and he's like, hey, I have to do this grand rounds, and we really need somebody from coding in there to explain to us some of the things that we need to know. And so I was like, okay, sure, I'll tell my boss. And he goes, well, this meeting is tomorrow and we need somebody now. So I said, to be present for tomorrow. And I said, okay, I will let her know, and if she says it's okay, I'll be there. And he's like, okay. And because I was still new, so I think I had been coding there for a couple months at the time. And I sent a message to my boss, and I was like, hey, and she's like, oh yeah, sure, go ahead. She goes, I trust you. It's fine. Go ahead. And so I went, and I was able to answer questions, and I made a little presentation, and I did this in a room of like 80 residents. So all these residents, all these new doctors are right there, and they're just staring at me with all their eyes and everything. So I'm just like, and I'm there by myself because there was nobody else there at the time. So I'm kind of nervous, and I was like, I got this, I know what I'm doing on this part at least, so I was explaining it, and I asked at the end, I was like, can I clarify anything? Does anybody have anything that they want to say? Nothing. And then when they dismissed everybody, all of a sudden I had this huge crowd around me because they didn't want to ask in front of their peers. So they were more open, with me personally, and they were like, okay, she's by herself, let's get her, So I was there answering questions for another 15 minutes or so, which was great. I loved that. But that was like my first taste of educating providers, which I enjoy. And now, whenever I get to educate my providers, I love to bring little snacks, some waters and things like that. And then I print off presentations for my providers, because I never trust the projector system. Like, they always have those projectors, something's always wrong with it, it never connects, and no. The time is so precious to me, because I usually get an hour, but here recently, in the last couple of years, my time has been at 30 minutes because there's so much with this electronic health record, again, which is why I don't like it. But so my time got cut in half, so every minute is precious. So I have just a small window of time to get with them and be like, okay, I can go at any time because my office is embedded in the clinic, and I can go and I can talk with them, and I walk in the halls and they see me, and they can come up to me at any time and ask me questions. So, but when I'm educating them, I will print off the slides, and I will bring enough slides for everybody. And these slides are not long. Like, how for coders, whenever we have like a meeting, right, and we're doing education or whatever, it's like usually 50 or 60 slides. Sometimes it's like 150 slides because we have so much information to cover. But with providers, you can't do that. You can't just hand them a stack of papers and be like, okay, we're going to go over this slide deck. They're going to fall asleep within the first 2 minutes. But if you hand them a little teeny tiny stack of like 10, no more than 13 slides, and that is including the cover page and then the reference sheet in the back, okay? But if you hand them a tiny slide like this, they're okay, because that's short enough information. It's right to the point. This is not going to drag on forever. They have time to ask questions, and that's the way that I've done it. And so what I do is I will have a sign-in sheet for my providers, because this is the thing about being a coder too. You have to do what is called CYA, right? If you don't know what CYA is, cover your keister. Cover your keister, okay? So you cover your keister. Why? Because you will have a provider who will say, oh, no one told me this. Oh, really? Oh, really? So what I would do is, I make a sign-in sheet, and I talk about what the title of the presentation is, and then just a little synopsis, like those key words of what's covered. Injuries, initial, subsequent, sequela, if that's what I'm talking about. So that way it's there. And then they sign in with their name so that they can get credit, right? Because even though it's not like where we submit anything, it's credit with me, okay? So that way I can turn this into my supervisor, and she knows, hey, she's putting in the time, and this is what she talked about, okay? So that way you always have that backup. Like, if they can never say, well, you didn't tell me. Well, you attended this briefing. Do you not remember? You know, like, it's right here, you know? So, but I make the sign-in sheet. I bring snacks. Like, I like to bring my little bear trap. It's like a basket of snacks. And these are snacks that I get with coupons or with points and things like that. So it doesn't bother me financially, right? And I'll bring in waters as well. And then just having this refreshment is like, okay, we can focus. Because sometimes it depends on when you have your meeting with your providers, that they'll be like distracted because they're hungry, or it's, you know, in the afternoon and they're really sluggish, and, you know, hey, a little pick me up would be good, you know. So, and it keeps them engaged. But I tell them sign in and take a slide deck, and so that way we can get started. And so what I do is I do not read these slides to them. I have them read them to me. And I've always asked them, I was like, okay, these are your slides. This is what we're covering today. And these slides is right to the point. Everything is right to the point. There's no excessive writing on these slides. It is just right to the point. And I said, either I can pick somebody to start reading, or you all can go around the room and y'all can read one slide after another. So somebody's going to read the slide. We're going to stop. We're going to answer any questions. I'm going to explain if I need to explain something. And then we're going to go to the next slide. And so they're like, okay. So they never pick the option of me picking somebody. They always start from one end of the room to the other. And that's how they do it. This keeps the provider engaged. This keeps the providers like, okay, we have to pay attention. Because how many times have you been in a meeting and you see people nodding off? Oh, well, not on my watch. Not on my watch. No, I don't allow that with me and the way that I educate providers, because I only have a few minutes. I have a very small window of time to be in there with all of them. And I like to get that message out as efficiently as I possibly can. So I want everybody's attention. And again, developing my own personal skills in public speaking has helped. And knowing like, hey, we've got to pay attention. How can I get that engagement? I've also learned that as well. So that's one of the best things. And whenever I have to do a class with providers, I love it. It is the most best thing for me. And I will get asked on occasion as well to do provider education for the residents. And I've been invited several times to do that. And I love to do that because you're getting the residents. And sometimes it's the physician assistants, that they're the students still new, right? And then sometimes it's the residents, like they're MD residents. And so they're the ones that I speak to, and, you know, we go over I like to touch on the new people, because This is a skill they need to develop. Medical coding is not a class offered in medical school. Documentation class is also not offered in medical school. It is just like, hey, you do this, you learn this, and then you run, okay? And you pick everything up along the way. And so I don't think that that's good. I think medical schools should allow for one class. I know it's a lot, they're already learning, but if they cannot effectively communicate what it is that they did for this patient, how good is that patient care? If they already did something and they didn't document it because they didn't think about it, and then another provider goes and does it, it becomes more expensive, and it's costly to the patient, and it's also, impacting the patient because they have to keep going over certain tests because it wasn't documented, that kind of thing. So that's where education comes into play. And so, but that's what I enjoy doing. That's what I like, as far as the coding side of the house for me. And again, not everybody's going to do that. There's some people who are terrified to speak to providers. I've had other coders come up to me and say, Blue, can you go and speak to this provider for me? And I'm like, you don't want to, why aren't you going? I'm scared. I'll watch you and I'll do it later. So I say, okay, and I'll go and I'll ask, okay, what's going on? And so they start asking the question, and then sometimes like a coder will say, I don't know how to explain it. So I'll explain it. And once I hear from the provider, like their words and what it is that's hanging them up, that's the thing that's, we're able to communicate better. And so it's just like, sometimes it's that light bulb moment. And sometimes you don't know how to like word things, and that's okay. Reaching out to a fellow coder is fantastic for that, because that's what you should be doing, because these providers should get priority when it comes to education. And I think that that's something that all coders should do. This is just my opinion anyway. But a coder that is developed though, or is working on their development, that is very important. Because sometimes with some coders, they take advantage of the situation, and they're like, oh, they're going to do what I say. No, you're going to work together as a team. Oh, I'm going to teach this provider a lesson. You're not teaching them anything, okay? You are going to work with them. Because if a coder behaves badly towards a provider, I've had this, where providers will come to me and say, well, Blue, I've never had a coder who will speak to me before like you do, because all I've had is when coders come up to me, it's just because I'm doing something wrong, or they did this bad, or whatever. It's always it's a negative thing. And they go, you're not doing that. No, I don't do that, because I don't want to associate myself with something that's negative. That's why I always tell coders, you need to communicate with your providers and do it in a professional way. I know that not every situation is going to be where you're always going to be all la holding hands, because there's going to be some times when you're going to lock horns with these providers too, but it all depends. And locking horns is a figure of speech, guys. It just means that sometimes they may be having a bad day, or the coder may be having a bad day, and there's a clash, It doesn't always happen, but it can happen, okay? Just so we all are clear. I've been yelled at before by a provider because he was having a bad day. And I let it go a couple times, but that last time I was like, oh no, I'm not, I didn't yell back at him. I just turned around and walked away, because you're not going to yell at me. You're not going to do that. But then that's me developing my personal self to not take that either. Okay. So these are just things. I don't want to scare anybody. There's always going to be somebody that writes me scared. Oh, Blue, I didn't know. No, it's not always like this. Okay. For the most part, everybody is professional. I'm just saying, for these once in a blue moon events, that they do happen. Okay. You just have to be ready. And the power of the coder that is ready for these things, and that you can handle these things. This is why we practice, right? It's like for these, remember the tornado drills, like when we were kids and you had to like hide under the desk? It's the same thing, preparing yourself for handling things professionally when people get upset with you, and it's because they don't understand. Because sometimes providers will get upset, and what I have learned when they start, they start getting loud, is because they feel anxious, because this is something that they don't understand. Like, why? You know, like they don't get it, you know, like it's coding. You're like, why can't they understand it? But it's their job as the doctor to take care of the patient and document what happened. And it's up to us as the coders to keep all of the guidelines and all that in our the forefront of our minds, so that way, you know, we can make sure that everything is compliant with the documentation, and we have to work with them, you know, in order to do that. So that's what it's like, you know. And some days I come home and I'm so happy because I was able to meet my productivity, and some days I come home and I'm so tired because I wasn't able to meet productivity, and it had everything to do with the electronic health record system. And you know, it's just one of those things. But when you when you find your happy place with your work and you see that there's good in what you do, that's the good thing, and that's what I enjoy, and that's what that's like. So while it can be tiring, it is also the best kind of tired, you know, because when you spend time, your own personal time, reading articles about like conditions that are common in your particular specialty, so that you can better understand, so that when you're looking at the documentation again, then it's like, oh, there's that light bulb moment and it makes more sense. That's what's going to make you like, now I get it. And that's where the passion comes in. That's where your joy for the field comes in. Okay. It's not, medical coding is not about chasing credentials. When I see that, when I see new coders, when they coming in and they think they need to get this big old conga line of credentials, it's just ridiculous. It's just being taken advantage of, because there's no need for a coder that's brand new in their first 2 years to have a whole conga line of credentials. Now, if you have one of the degrees, RHIA, RHIT, the degree designation, right? And you get the CCS, CCA, CCSP, or CPC, that's understandable, right? Because that's the coding portion of it. You know, the degree designations are for our leaders. So when you have a coding credential with it, that's okay. But when you're sitting here just racking up credentials and you're just taking tests just to be taking tests just so you can get another credential on your name, it doesn't show any improvement. All it shows is that you have spent money on a bunch of tests. You only need one for the first 2 years. And then later on you can see, you know, if there's anything else you want to get. You know, that makes sense. But that's just the business side, you know, of coding. You need to be more concentrated, especially when you're brand new, on the learning side of coding. And it just takes one credential to get you in. I've never seen an employer say candidate must have multiple credentials to get this job. Never. Never. And for those of you who say, well, what about the CRC? They also say if you want to apply for risk adjustment, they're willing to accept CCS, CCA, or CCSP, or CPC. You know, think about that, you know. So, but with that said, that's my message for today. That's what it's like. It is the most exhilarating when you figure things out. It is the most tiring when you feel like, am I ever going to learn anything and everything that I need to know? That does get tiring, because you're like, oh my gosh, am I ever going to get it? You will get it. You know, you just got to stick with it. There's a lot of people that just want to give up so easy on things, and you can't do that as a coder. You have to stick with it. You got to see it through. You got to get that resilience down to a science, because that's what we do. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.